And right now, the Global Fund has finally approved a 48 billion shillings grant for the management of HIV, malaria and TB in the country. But it has come with a set of conditions. The donor has demanded transparency in how the funds will be spent and in the administration of health services. This much-needed shot in the arm comes in as KEMSA is mud in a fog of corruption and irregularities, and more recently, the disruption in the supply of HIV drugs. NTV's Helen Aura now reports.
The Kenya Medical Supplies Authority has been faced with a lot of credibility questions when it comes to its mandate, with the most recent scandal being the supply chain of antiretroviral drugs. The global COVID-19 pandemic and HIV epidemic has shown the crucial role global funding has in helping third world countries combat them. But the help does not just come, it's earned.
We need to formalize community health services, Bwana CS. Community health services, as you've seen, are the ones that actually make this grant work. Whether it's HIV, TB, malaria, community health services are critical towards achieving universal health coverage. We have trained in the last grant over 150 civil society organizations to be able to mobilize budget from county resources.
The Global Fund and various stakeholders are giving a shoulder to lean on with the 48 billion shillings. But there is a caveat. Stakeholders are demanding transparency. KEMSA has been accused of being opaque in its operations, hence the stalemate in the disbursement of the antiretroviral drugs. Just last week, there were protests as the deadlock led to shortage of the crucial medication. To this, the Global Fund head Mark Eddington said, and I quote, "We request the government of Kenya to pay urgent and ongoing attention to resolving the issues at KEMSA, including addressing the recent disruption in the supply chain for the critical drugs for HIV. We also request that the government of Kenya puts in place mitigation measures to ensure timely procurement of health products, including for COVID-19, which are critical and urgent. Some of the lead times we have seen are unacceptably long." The Global Fund's Office of the Inspector General audit is currently ongoing. We will be reaching out to discuss some aspects of the audit and obtain clarification and additional information to supply the audit process. Meanwhile, county governments are also asking for a fair share of the funds to support their healthcare systems.
The Council of Governors commits to the following. 1. Advocate for the inclusion of the county governments in the direct implementation of the Global Fund activities. 2. Ensure increased visibility of budgets and activities implemented at the county level. And 3. Enhance coordination of partner support in the health sector.
There is, however, a more urgent matter to settle among stakeholders. There has been an ongoing tussle between AMREF Africa and Kenya Red Cross over who would be the principal recipient of the HIV funds. Ultimately, Kenya Red Cross was made the principal recipient of the funds. Helen Aura, NTV.